Well, thanks for joining us today for the Zoom call. I think all of you have sat in on a Zoom call before. So again, I'm Stacy Lee. I'm the administrator. Today we have with us Gail Oxendorf, who you all know is the activities director. Actually, Gail Schlimme. Keep forgetting your last name, Gail. Melissa Moe. We're going to introduce Melissa today. She is up. She's actually joined us as the assistant director of nurses in the care center. So I think this is day, is it 5 or 4? 4.
Who's counting?
We're super excited for Melissa. She actually worked with us before some years ago, and she comes with a lot of experience, and I know her and Amanda are looking forward to moving forward some initiatives that have been hard to do without an ADON in place. So Melissa, I don't know if you want to just say hi to everybody and maybe give just a little bit of your background.
Yeah, I feel like I started my career years back when I was an LPN, probably 20 years ago, and from there I've worked in hospital settings, home care, hospice, so I have different areas of experience, and come back to where it all began is what I say.
And her son is actually Mitchell Moe. He used to go to school in Dawson, but he's actually going to, what year is he in medical school right now?
Third year.
Third year, so starting residency next year.
You know.
We're going to be making a call to Mitchell again.
Yeah.
There's no shame in our game around here, so. I won't go over the housekeeping rules because you guys all know those again, but if you want, just put a question in the chat box, and we're very informal, so feel free to just ask questions as time goes on here. So again, we'll start a little bit with going over what's going on with our residents, a brief overview of COVID, on COVID review on our nursing home reopening, a little bit on outdoor visits, and then open it up for questions. So yeah, we've already gone over that. So go ahead, Gail. I'll let you take this part.
Okay, as you can see, there's some photos up here in front of you. There's the outdoor visit. Myrtle's having an outdoor visit. And then we had our first bus outing where everybody's wearing masks and social distancing. And then on that trip, they went to around the lake area and went over to see the new Milan Bridge, and almost enjoying the outdoors there. I think the residents really enjoy getting out. We're going to get the bus out a lot more. We haven't gone on another bus trip yet, but the golf cart's been out. And as we get going on the bus, we'll probably do 2 trips a day on the days that we go, so more people can get out, because it can really only realistically get 4 out at a time. So today we had our traveling happy hour, and the featured drink today was margarita. We've had root beer slushes and daiquiris, and beer is always a popular thing, and a lot of them just like a glass of pop with popcorn. So we have popcorn and puffcorn today. So, and it was during a Elvis movie today, so a lot of them watched that. We have some of our small groups that are coming up. We are going to start next week with our manicure group again, so that'll be starting, and we're going to do some small group games where we can disinfect things in between. So we'll gradually be starting some of those things. And our music, for the first time tomorrow, we'll have Terry Nelson here, and he will be over the TV screens. But as we get opening up a little bit more, I'm hoping that we can have some of the residents actually come down and be in the room where he's playing. So we're hoping to get things kind of gradually opened up a little bit, but yet follow the rules for the social distancing and the disinfecting and all those good things. So do any of you guys have any questions about activities or? No? I should say that we do have one of the things that we have coming up is a carnival day. So residents are kind of looking forward to that.
Thanks, Gail. We'll again just go into our COVID review. We do this every week. And I know you see numbers on the news all the time. So we're just going to give a quick overview here. We're a little over 52,000 confirmed cases in Minnesota, a little over 1,500 deaths. But we started to add this extra column called recovered. Because of the 52,000 confirmed, you can see that 46,000 are recovered. So that's a really good thing to see, and hopefully has a little bit of positivity inserted into some of these numbers as well. So again, we're not one of the least infected states, but we're in that second rung. So we're not one of the most heavily either. So we're looking, and we'll show in our own county. So in our own county, we continue to stay at that 6 confirmed cases. So just as an FYI, we did have, we did a little stats checking on our tests. So far, we've had about 160. We've completed 160 COVID tests at Johnson Memorial. Of those, we've only had 1 positive test, and that positive person did not live in our county. So these 6 are from other areas. So we are testing. I think last month, the month of June, we tested 62 people. We're just not seeing the positives, which is a good thing, or the hospitalizations. But as you can see, Chippewa right around, right across the border there, or not across the border, but just next to us, has 90 confirmed. And we keep an eye on those around us. Candy, Ojai is a big one, and Lyon County and Marshall. As a quick update, they did do a 2-day or 2 or 3-day testing, community-wide testing in Marshall and Tyler. And they did a little over 1,000 tests. And of those 1,000, I don't have the sheet right in front of me. Oh, yes, I do. Of the 1,000 that they did in the Marshall and Tyler communities, there were 77 positives in Marshall and 16 in Tyler. And I don't have the breakdown of Marshall, but in Tyler, of those 16 positives, 7 of them were ages 11 to 17, and 9 were ages 25 to 50. So it's not necessarily all the 85 and older people. So just kind of keep that in mind. Pipestone just did some testing as well. They did a community-wide testing event, which was 2 days. They did 220 people. Hey, Gail, can you hit mute? I think there might be some background. They tested 220 people, and I don't know the exact, but very low testing for positives. So that's good to see. In Marshall, they only currently have 1 hospitalized patient for COVID. Dawson, Appleton, Montevideo, Madison, I don't believe we have any hospitalized COVID patients at the moment. So we're just continuing to focus on testing. Again, facility occurrences in our care center, and assisted living, we've had 0. We've performed some tests, but we've had 0 positives. So do you guys have any questions on COVID testing at all? Otherwise, we can catch them at the end if you have any specific questions. So this next section is talking about our reopening as we continue to follow the Minnesota Department of Health guidelines, which is statewide. Of course, everyone knows about the all-state masking mandate. So we've already been instituting that in our care center for quite some time, but it's instituted across the state now. I believe we talked about these essential caregiver visits at our last week's meeting. And a letter has been sent out, as well as a draft policy for your review. This coming week, we're going to be finalizing that policy. We haven't received much feedback on it, but we'll be finalizing it and then relaying out instructions about who can request that. So if one of you or a family member or friend wants to request this essential caregiver designation, that we would give you those instructions on how that fits, and then working on a schedule and moving forward. I will say that our Zoom visits continue to be utilized very heavily. Some residents use it much more than others. We also are doing many outdoor visits. They seem to be scheduled throughout the day. You always see family members with residents out there. They're wearing their masks and social distancing. And now these essential caregiver visits. So we're so glad to see opening up things safely so the residents can get that love that they've been missing, that, you know, face to face, at least they can see each other. So Gail, do you have anything you want to add about the essential caregiver guidance or any of the other reopening items?
I just so if you're wondering, the emails just went out today, and so did the mailing. So if you get it by mail, you should get it the next few days. But just so you're aware, if you didn't get it by email and it's coming by mail, it might be a day or two before you get it. What we sent out. And yeah, otherwise I guess I don't really have any more on that, just that people are enjoying the outdoor visits. And like you said, Stacy, some still prefer the window visits. It just depends on, you know, whether you have hearing issues or just, you know, don't want to do the Zoom thing. So everybody's got their own way kind of connecting, and it seems to be working well for them.
So this is just a couple things with the outdoor visits. You know, they're limited to a family, partner, or close friends. Every visitor has to be screened with temps and asking the symptom questions. You have to wear a mask, stay 6 feet away from each other, a limit of 4 visitors per resident at a time. 30-minute visits, there are exceptions to that if people are driving a fair distance away, to just work directly with Gail or our DON. We're accommodating that as much as we can because those visits are important. They're available all week, but make sure to call and get that set up so we can help coordinate that. And if it's raining, you know, it may be canceled. But I will tell you, we're working hard to figure out a space to use if the guidelines don't let up or if the COVID cases start to increase. We're working on some spaces indoors to allow for these visits as well, because we know the weather isn't going to stay like this very long. So we're thinking about the upcoming fall and the colder weather, colder temps coming in. So I should have mentioned this at the beginning, but Amanda actually went home a little ill today. Nothing related to COVID symptoms, but she's hoping to be back again next week. And just wanted to extend that, that she wishes she could have been here, but she did go home a little bit after noon. So I guess now we're just going to open up for questions. So I know, Kristen, you can unmute everyone. And if anyone has anything they'd like to ask or discuss, that's great. Oh, Diane, you might need to unmute yourself. There you go.
What type of COVID tests are they using, the nasal or the throat?
We're using the throat swabs.
Okay.
Who did the letters go out to for the essential caregiver? Did it go out to one family member per?
Gail, you have to unmute yourself. Gail, you have to unmute.
Sorry. The letters went out to the primary person for most of them, and there was a few families that had more than one listed as a primary person.
And that's what went out today?
Yep, the emails went out today, and so did the mailings would have just went into the mail today.
Are those the same things or two different things?
They're both the same thing. We just don't have emails for some people. And so.
Okay.
Yeah, I've got a copy of it right here. I see it come in, so.
Oh, good.
That's good.
It's about 7 pages long, I guess.
It's a little long.
The letter isn't that long. It's just the rest of the information.
Yeah.
So if we have
Nursing homes are the most regulated industry in the United States. there's so many regulations to follow. It gets maddening sometimes, but the intent is all very good. So
Right.
If we have questions, should we wait until we get the email or the letter, because that may answer our questions?
I think it probably will. And once you get the email, you can easily just forward your questions right to Amanda. I believe that has the her email addresses right on the letter. The one-page letter that should be in the front has Amanda's email in there.
Or wait till the next meeting? Wait until the next meeting?
Yep, either way. Yep, you can either just email your questions or ask at our next family Zoom meeting. Well, great. Well, I so wish we'd have some more participation. We appreciate you guys calling in for these, and I think we need, maybe we need to make some calls or work on that just to see. But sometimes it's a difficult time for people, but we so appreciate the time just being able to take a few minutes, talk about some of the updates, and that you guys joining in. So I hope you find them valuable.
I have a question.
Go ahead. Go ahead, Diane.
Actually, it's kind of a comment, kind of a wish list thing concerning activities. My mother has memory issues, so we ask her questions about what she has done. Like, I think in the last meeting there was a comment about a pizza party. So on her last visit, I asked her about a pizza party, and she didn't seem to know anything about it. And I asked her about the golf cart, whether she'd gone for a ride on the golf cart, and she didn't really seem to know. So my wish list is if there was some way family members could find out what a person participates in, because my mother, I don't think she remembers anything that she has participated in. And I don't want to create more work, but I'm sure my mom participates in events and things going on, but we don't know anything about them because she doesn't remember. So that's just a kind of a wish list thing.
Okay, well, and I certainly can, talk to you individually and let you know too.
Okay.
If you want. Yep.
Yeah, because we do track all those. And I think a few meetings ago, which we should have brought to this meeting, would have been great too, but we do track the number of touches each resident has and the type of touch it is, just to make sure that we share that with our board every month as well. So, and so if we track the number of touches, I'm sure we have the names attached to those, and Gail tracks all that for their MDS and for their own records. So might be something that we just want to do on a monthly basis. And if we're tracking it anyway, and we sure could send it out to the primary person via email, it gives something to talk about too and jog memories. So it's a great suggestion, and maybe we just probably need to talk through it, and we could maybe bring it with to this next family Zoom meeting and see what we've come up with.
Like I said, I don't want to create more work for anybody, but like my sister lives in Switzerland and she does her Zoom call once a week.
Yeah.
But I think when my sister talks to her, there's a lot of things that my mom doesn't remember that she did, that I'm sure she did, but she doesn't remember the activities she participated in or anything. But, and I know, like I said, I don't want to create more work for somebody, but I'm sure my mom participates in different events and things like that, but she just does not remember. And I'm sure she's not just sitting in a room all day. I'm sure she's doing things, but she just doesn't remember.
She is out doing things.
Yeah, that's what I figured.
Yep.
I like Diane's suggestion about the touch, as Stacy pointed out, the touch events or whatever you call them.
Mm-hmm.
That wouldn't be bad if that be somehow made public, at least to the families somehow, or shared with the family somehow. I'm just trying to say that's a nice idea, I think.
Or if there's even some sort of system. I know with my with my doctor, we have a portal system where you can go in and check out things. If there was some sort of system,
Right.
Again, on my wish list or whatever, where you could go in and if you had a code of some sort where you could sign in and check out what your family member did, you know, what they participated in. But that's just something that would be nice if there was such a program or something like that. So.
Oh, Gail, you're muted.
I think that sounds like a great idea. I can kind of relate to that because my mom was in the nursing home, and yeah, even when I would stop in to visit, I know that she had done things that she didn't tell me about. So
Yeah.
I think that, yeah, it's,
And I think it gives you something to talk about their life and what's going on. And so I think it's a great idea. We just have to figure out how to make it happen.
yep, we'll just have to work on the way to do it.
Yeah, that's the problem. It's not as it's definitely not as easy as it sounds.
But it's important, and we'll work on some ways. So thank you for that.
And I'm always willing to share individually. So if any of you ever have any questions, either call or email or whatever.
Thank you.
Yep.
Say, Stacy, what do you envision for this fall indoor meeting room, if that's what it's going to be called? Is it any thoughts on what you're looking at?
Yeah, we've had several thoughts about it. You know, I think we have to be pretty nimble regarding what's going on with COVID in the state and in our community, as well as what's going on with the potential vaccine. It's not even necessarily what's going on in our care center, it's what's going on outside of our care center that affects things. So, but we've looked at, we currently have a daycare, Blackjack Babies, which has been wonderful for our residents as well. But with COVID going on and with our limited space, we've talked with the school and we're working on a plan to transition those students over underneath that one umbrella at the school, and then just having the children come up here to visit, and possibly using that space as a visitation room that we can disinfect in between family visits. It might cut down on the traffic walking through the hallways and the potential exposures of people coming in. So we would bring the resident to that space, and then the families, it's one option. But yeah, we have, you know, with the essential caregiver visits, if things keep going, if things go down, we can continue to use more of those. I think we also have the whole town center that we've tried to keep pretty open right now, that we could utilize with, I know Gail's working on eventually, or getting some more group activities that are spaced apart, like she had mentioned. So we have some areas that we could utilize. We're just trying to figure out the best way to do it and still comply with the guidelines as best as possible.
Good. I'm glad to see that's being addressed. That was a question I had in the back of my mind. I hadn't thought about asking it yet, but that's good.
Yeah.
Thank you.
Yep. And I think I mentioned before, we do have the 5 rooms on the east side of the assisted living. They're available for the isolation. So if we did have a resident or an assisted living tenant that tested positive, those 5 rooms are separated by their own hall, have their own entrances, can be siphoned off to hopefully prevent any spread until they were to receive negative tests and be done with their positive tests. So so far we haven't had to use it, knock on wood, but it is there. So we're just trying to do what we can to minimize the chance and without disrupting people's lives more than they already are.
Just a comment. I think these weekly meetings are very, very informative, and I appreciate you bringing them on into the Zoom platform. And
Good.
and I do think as the weather gets a little bit more probably inclement, you're going to have more attendees as well.
Yeah. And when COVID is under control, maybe it's something we still do once a month. I know Gail had sent out some information on the family council, like the resident council.
Right.
And that might be something that we just keep doing, but we do it via Zoom so people that aren't located in the same community can be a part of the family council. So
Yeah, I don't think you should drop the platform, at least completely. So.
Yeah. Okay, well, it looks like we're close to wrapping it up. So thank you all for joining in on the call this week. And like we said, we'll have a lot more information on essential caregiver visits next Wednesday. So have a great rest of your week and we'll talk to you next week.
Thank you. Goodbye.
You guys.